So we have an 11-year-old girl who's in good health until she was admitted to the hospital. She's tired all the time, no energy, appetite was great, but she's always thirsty, drinking up to a gallon of water a day. She's voiding large amounts of urine. Her respiratory rate is elevated. She has dry mucous membranes, low appetite. Now she has low appetite. Earlier she had a great appetite. Now she has no appetite. Strange fruity odor on her breath, and she lost 5 pounds in the last month. So looking at these values, we can put an up or down arrow next to each value. So body temperature is high or low or normal. That's normal. 37 is normal. So what does that tell us, the fact that she has a normal body temperature? Probably not infectious, right? Yeah. But people can have an infection without fever too. But blood pressure really is high. Not, you know, for an 11-year-old girl, that's high. Blood glucose, there's your normal value, 70 to 110, really high. Ketones in the urine, that's abnormal. Potassium, high. Sodium, low. Hematocrit, yeah, not terrible though. White blood cells, yeah, it's not greater than 10,000, right? So then her pH, what we say that is? It's low. PCO2, it's a little low. Bicarbonate ion, also low. Urine specific gravity, is that high or low? So it's a little on the higher end, right? A little it has a lot of solute in it. And it's positive for glucose and positive for ketones. Should we see either of those in there? No. So that's a problem. So this hematocrit is, I'm just looking it up, it's 54. The normal hematocrit for females is 37 to 47. So her hematocrit is actually high, which means when we see a lot of red blood cells compared to plasma, that's a sign of dehydration. So she has dehydration. And what would cause the dehydration? She's drinking all that water. What else is going on? Yeah, she's voiding a lot, so that's going to cause the dehydration. Okay, so things that are abnormal, we just talked about that. We just looked at that, so you don't have to write that down. What term do we use to describe high blood sugar? Remember that from the blood lab? Yeah, hyperglycemia. Emia is the blood, so hyperglycemia. And the glucose in the urine, what term do we use for that? Glycosuria. Glycosuria. And how about the presence of ketones in the urine? Ketonuria. And do you remember how ketones are produced? Like the ketone, yeah, it's as a result of when there's no glucose available for cells, they break down fat and protein and turn those into ketones are produced as a result. So when there's no sugar available for cells, they produce ketones in the process of breaking down fat and muscle. So what would be consistent with ketone production? Is she losing fat and muscle? How do we know that? What does it say? Yep, she's lost 5 pounds. And how's her energy level? No energy. So she's losing muscle as well. And so she has ketones in the urine. We already identified that. So that's another indication there's issues. So what is the most likely cause of her condition? What causes someone to have a really high blood sugar? Which is caused by what major disease? Diabetes, yep. So she has classic symptoms of type 1 diabetes based on her age of 11 years old.
So I had a question about that. Is there an age cutoff for type 1?
Not really. Some people have been diagnosed later in life, I've seen. Yeah, so it kind of just depends. Yeah. It's typically in the first half of life. Yeah. Okay, so which organ is not functioning properly? The what? The pancreas, yep. And what part of that organ is diseased? Do you remember the cells that are in charge of making insulin? We looked at them in a slide even. The islets of Langerhans, the beta cells in the islets of Langerhans. And what body system is the pancreas part of? The hormone one. Endocrine, very good. So you would have to see an endocrinologist then if you had diabetes. That's what you would see. So what kind of fluid or electrolyte imbalances are going on here? Fluids. Any issues with fluids? Yeah, she's got a little on the high end of specific gravity for her urine. And electrolytes, what did we say? Potassium, she has what? How would you describe her potassium level? Hyper or hypo? Hyper, and then what's the term for that in the blood? Hyperkalemia. Hyperkalemia. How about her sodium level? It's low, so we would say she has hyponatremia. Yep. So she has polydipsia and polyuria. Which one came first, do you think? What did we learn today when we have excess sugar in the blood? What is that? The thirst? What would cause the thirst? Dehydration. So what causes dehydration in this case? Yes. Yes, exactly. Polyuria causes the polydipsia. Just like we talked about in lecture, if someone's drinking too much alcohol, they're urinating a bunch and then they're thirsty as a result of that. So that's a diuretic. We talked about in lecture too that high blood glucose is actually a diuretic because it pulls water into the nephron, all that sugar. So polyuria led to polydipsia because of all the sugar in the nephron hangs on to fluid, causing increased urination. Does she have an acid-base imbalance? Is her pH normal? It's low, so the answer is yes. She has an acid-base imbalance. And what kind? Is it a lung cause or something outside the lungs causing it? Metabolic acidosis. And what's causing it? What's being produced in her body that can drop pH? When we're breaking down fat and muscle, because there's no glucose, what did we say that produces? Ketones. And ketones can also be called keto acids because they have acidic properties. So they release hydrogen ion. So ketones are being produced, dropping the pH. So her urinary and respiratory systems are trying to compensate. So the respiratory system, what does the respiratory system want to do with a low pH? What would raise the pH? How can the lungs raise the pH? All they can do is affect the respiratory rate. They can either speed up breathing or slow it down. Yeah, by speeding up breathing, that blows off excess CO2 and would raise the pH, right? So the lungs are trying to compensate. Is her respiratory rate higher than it should be? It's at 28. Yeah, so she's definitely breathing too fast, as her lungs are trying to blow off that CO2 to raise the pH, because we know CO2 makes acid. So it's trying to get rid of the acid-causing substance, but that's not the cause, right? The cause is metabolic. And then what are the kidneys doing for the bicarbonate ion? If you have acidic conditions, what would the bicarbonate ion want to do with that? Would you want to hang on to bicarbonate or get rid of bicarbonate if you have a low pH? Because remember, bicarbonate is base. We want to, you'd want to keep it, right, to raise the pH. Are the kidneys keeping it in this case? No. And the reason why is because this is a young girl. She just came down with this. Have the kidneys had a chance to respond? Probably not. It takes a little bit for the kidneys to compensate. So that's why it hasn't done it yet. But if we would come back, you know, but people don't usually live very long when they're in diabetic ketoacidosis. So, but let's look at the example of someone with bad lungs, with emphysema. They're going to have a high PCO2 forever, and the kidneys are going to respond, and they're going to have a high bicarbonate ion also chronically. We would expect to see that in someone with emphysema, because they're never going to fix the lungs completely, and the kidneys are always going to try to compensate. So you'll see a high bicarbonate and a high PCO2. Okay, so we talked about that. She has a metabolic acidosis because her body is using ketones for energy, which are acidic. And then we talked about that. So we know she does not have an infection because of the lack of fever and the normal white blood cell count. Now we're going to talk about Joe Cool, a smoker. Nice name, hey? I don't understand where Angela Samrai comes from. All the other ones had fun names, and then there's Angela Samrai. It should have been Sarah Sweetheart. Wasn't that last week? Anyway. Yeah, true. So what's his issue? He's got shortness of breath, so he can't climb stairs. He has shortness of breath at rest as well. He was discovered by a neighbor confused and in significant respiratory distress. He told the neighbor said that Joe has been ill for several days. He's deteriorated significantly. His color is a gray-blue. His pulse is 140. Is that normal? No. They drew his blood. He's got a barrel-shaped chest, and he's using abdominal muscles to breathe, and he's taking a long time to exhale, which is classic emphysema, right? So hematocrit, high or low? Way high, way high. How about white blood cells? Yep. How about, well, these other ones just tell us about his immune function. We don't have to look at those. Specific gravity, a little on the higher end, yep. pH of urine, it's on the lower side. It's normal, but it's on the lower side. And then pH overall is low. PCO2, very high. So right away we see opposite, right? Low pH, high PCO2, we know have a respiratory cause. So this is definitely a respiratory acidosis. Bicarbonate, high. So are the kidneys compensating? Yeah, they're hanging on to this basic bicarbonate in order to fix this low pH. So the kidneys are definitely compensating. And the PO2, is that normal? No, that's low. It would make sense, right? He's struggling to breathe, so he's probably going to have low oxygen levels too. So something significant is going on. And this is the classic patient of the ones we take care of on the cardiopulmonary floor. So they have underlying lung disease and they have an exacerbation of it. So we call it respiratory failure or COPD exacerbation. And then we fix it by doing a couple of different things, get them stable, and then go back home again. So we talked about what's important information, what's abnormal. What is the most likely disease? We already said is emphysema. And the factors that support that, he's got a really high PCO2 level, and we know emphysema, they cannot blow off carbon dioxide. And he also has a low oxygen level as well. And he's got the barrel-shaped chest. That's when you blow out the alveoli in the lungs, it causes them to expand, and they can't collapse because there's no alveoli to have that surface tension and shrink the lungs when we exhale. Yes, yep. They have to actually use their muscles. That's why they go when they have emphysema, because they have to force the air out. It doesn't just naturally collapse with surface tension. Yeah. Okay. Number 3, what evidence suggests his condition is being worsened by something that's acute, which means sudden and not related to the underlying disease? White blood cells are 11,800. Is that high or normal, did we say? That's high. So what do you think might be going on here? Yeah, probably a pneumonia is happening here, and that's why his white blood cells are high. And people with emphysema are more at risk for pneumonia, so that would make sense for that reason as well. So he has a respiratory infection of some kind. Does he have an acid-base disturbance? Yes, we already said that. He has respiratory acidosis because he has a high PCO2. And he does have kidney compensation, right? Because we said the bicarbonate level was also high. So respiratory therapy came in, gave him some breathing treatments. Doctor prescribed some steroids for him to take to decrease the inflammation, maybe some antibiotics if he's on, got a bacterial pneumonia. And now things are looking better. He feels better. So now we draw some more blood. Is the hematocrit normal? It's lower, but it's still high. So if someone has chronically low oxygen levels, the kidneys respond by secreting what hormone? Do you remember? It tells the, EPO, erythropoietin. Yeah, so it's going to respond by secreting more EPO to make more red blood cells. So people in this state are always going to have a high hematocrit, and it's not really considered abnormal. It's kind of like a compensation. So we wouldn't expect to, we're not going to fix that hematocrit. They're always going to have that because they're going to have lower oxygen levels than the average person. White blood cells, back to normal. So we fixed the infection. That's why he's feeling better. Specific gravity is coming down. pH is coming up in the urine, so we're not quite as acidic anymore. His overall pH now is normal. PCO2 still high, and we're not going to fix the lungs, right? We can fix the infection, but we're not going to fix the emphysema, so he's always going to have a high PCO2. And the bicarbonate, okay, so that went up because the kidneys are compensating, so he's still high. And the PO2, yeah, and that's the most important, right? We want to make sure that they're getting enough oxygen. So does he have signs of an active infection or acid-base disturbance? No. No, no. An acid-base disturbance? No, his pH is normal. Because his kidneys are compensating and fixing it. So he has a normally functioning urinary system, so the pH is low. So because of this high PCO2, his kidneys are reabsorbing bicarbonate ion, and they're also secreting hydrogen ion into the urine. That's why he has such a low pH. So there's two things that are going on here: secretion of hydrogen ion and reabsorption of bicarbonate ion. Both of those are going to help keep that pH in the normal range and cope with that chronic acidosis that could be occurring with that high PCO2. Questions on that? Okay, so your lab exam is going to talk about different states of alkalosis or acidosis, and you're going to have to know if the kidneys are compensating. So I'll ask you some questions. You have a high PCO2 and a low pH. What's the cause? Respiratory. And if I have a low PCO2, I just said that. If I have a high PCO2, no, I said that. Oh my gosh. I have a high pH and a low PCO2. That's what I wanted to say. It's still opposite, so we know it's respiratory, right? Okay. So again, whenever you're looking at trying to decide respiratory or metabolic, start with the pH. Then you'll know if it's alkalosis, acidosis. Then look at the PCO2. That's the second step. And once you've determined if it's opposite, it's respiratory. If it's the same, then it's metabolic. And then you have to figure what kind of metabolic. You have to look at other factors that are involved. And then again, the kidneys can compensate by either increasing bicarbonate or decreasing bicarbonate. When would the kidneys want to decrease bicarbonate? What kind of pH would they decrease bicarbonate? Right, because bicarbonate is basic. So if pH is high, you'd want to get rid of that basic bicarbonate. We would see a low bicarbonate ion. And then the opposite is true. If you have a low pH, we would see a high bicarbonate ion trying to fix that with compensation. So what happens if I have a low pH and a low bicarbonate? If they're going in the same direction, if I compare pH and bicarbonate ion and they're going in the same direction, then I know that's a metabolic cause. So it's helpful, I think, to look at the PCO2 first and just remember if they're opposite, you're talking about a respiratory cause. Because CO2 makes acid. So the more CO2, the lower the pH, and vice versa. And remember the causes, because he might ask you that as well. Yes, this chart here is on Blackboard for you. So then you have the worksheet that just reviews some of the vocabulary regarding pH. And again, make sure you pay attention to acidic solution versus acidosis in the body. What's the number? Acidic solutions are less than 7. Acidosis in the body is less than 7.35. And vice versa for basic solutions are greater than 7. Alkalosis is greater than 7.45. All right, well, that concludes the lab on acid-base.